We spoke with a group of people with OSA to find out what they think is the most important information to share with the newly diagnosed individual. I'd like to thank all of you for coming today and sharing your experiences about OSA and CPAP therapy. We'd like to welcome Lanita and Dave Myers, Raul Guevara, Dr. Matthew Abraham, Peggy Jennings, and Dee Stanley. What do you think is the most important information that you could share with someone who's just been diagnosed with OSA?
Imagine having treatment where you don't have to take medicine, you don't have to have surgery, you don't have to go to weekly follow-up visits to the doctor. There's a solution to the way you're feeling without medicine, without surgery, without any invasion into your life, and it's going to change your life, and it's easy to do.
I'm a physician who practices in this field of sleep, and the spouses and the people around you are vital for the information. A lot of times we have no awareness of the sleep problems, and the people around you have to tell you that there's a problem for you to really know it's there. Right. In other words, you may just feel sleepy, sure, but you think there's nothing wrong with your sleep. Sure. And actually that's not normal, and many times the people around you will notice those problems.
You know, hunting camp stories, nobody sleeps at hunting camp. I mean, I think anybody goes to hunting camp, there's always 2, 3, 4 guys in the house that are, you know, you put them back in a corner somewhere and close the door and just hope that you can sleep on the other end of the cabin. My
last camp story before being diagnosed 10 years ago, I remember vividly because I got back late to the room where we bunked after a card game, and my roommate had very carefully taken all of my clothes and all of my things and placed them outside the door in the hallway and had locked the door and would not let me back in. And there were 2 or 3 of us, so they would assign the people who snore and had apnea together. There are 3 guys who were with me on that trip who are now all on CPAP machines.
Well, in my case, I did know, but I was in denial, see? So I knew that I probably had it, and I was told that I probably had it, but I was just not going to go and have a sleep study done because I thought in my head, there's nothing wrong with me, and I just snore because I'm tired when I first go to bed. Damage is being done, whether you know or whether you're in denial.
This is something serious that people deny exists in their life, and they try to attribute the cause to other things, a stressful work environment, or I'm going through a rough time right now, or I've always been that way, or I sleep fine, I just snore, you know. Why wouldn't you go to the doctor for that?
That's true. And I know it took you the longest to get to a sleep lab. What were your apprehensions? What was your fear?
I could not imagine sleeping with a mask on, and I just denied that there was anything wrong with me. And after I finally did go to the lab, I watched, there were 4 other patients there besides myself, and I watched them connect these people up to whatever. And I said, they're not doing that to me tonight. And they said, you ready to go to bed yet? I said, nope. And I mean, glue and whatever other stuff, wires all out of your head, off your chest, everywhere. I said, now how do they expect you to sleep with all that stuff on you? I finally gave in and let them hook me up, and I slept. I slept that night.
My reaction when the doctor said, you have sleep apnea was show me the videotape from the sleep lab. I don't believe it. I felt like I had slept a great 6 hours in the sleep lab. Then you look at the videotape and you look at the numbers and it's scary. That night I felt wonderful. The next day, we're all in the Respironics club now. The next day, it was the beginning of the rest of my life, basically. And I think if you talk to these guys, they'll tell you the same thing.
When I woke up in the morning, I couldn't believe how good I felt. And then I just wanted to find out how soon I could get one of those machines to take home.
Right.
Because I wanted to keep on feeling that good. Sure. So it was amazing.
I've never felt so great. I've never felt so great. And I just would like to say to anybody who's listening or who might see this video, you owe it to yourself. You owe it to yourself to feel better. You owe it to yourself to find out what's going on with your body and to do something about it. And it's not as bad as I thought it was.
What advice would you give to the spouse of someone who's going through PAP therapy?
It's a life change for the better
Oh.
in both aspects, the patient's aspect and the spouse's aspect, because you're actually going to sleep, both of you. It's going to change your relationships, including your spouse, including your family, including your children, including your job. I mean, it is truly all-encompassing.
Your group really had some great information to share. As I watched, I was thinking about how using PAP therapy is a lot like playing a sport.
Playing a sport.
Sure, you need the right equipment, you have to practice to achieve regular all-night use so you can be at your best, and some people are naturals, while others need coaching. Finally, you need to regularly check and maintain your equipment.
Join us for the next segment of Inside OSA. And again, thank you for watching. A sport.